My current role within NHS Borders as a nurse consultant within a section of public health called health protection has drawn me into an official twinning relationship that exists between my employer and a hospital in the eastern province of Zambia, St Francis in Kitete. Since 2012, I've been making several visits to support them in their work. The personal reasons for getting involved in this twinning link with St Francis Hospital in Zambia really goes back all the way to 1981. And that was a time when I just didn't have a career pathway at all. And I ended up doing some building work in a very remote part of northern Kenya and the Sudan border. And there were no doctors, and there was a health post, and there were just nurses there. And I looked at them and I thought, you know, that's what I'm going to do when I get back to the UK. I'm going to train to be a nurse. So I owe a real debt of gratitude to Africa. So that's a personal reason. So when I joined NHS Borders and found there was a twinning link, of course, I just put my hand up and said, I'm your man. Of course, healthcare delivery in Zambia as opposed to the UK is so different. And one could be forgiven to think that professionally, well, there's nothing much I can learn, I can only contribute something. And how wrong is that as an attitude? There's so much I have learned really from my involvement there. I think one of the biggest things has been the need to really challenge the status quo. Having worked all my professional life in the NHS, it's very easy to get institutionalized. It's very easy to accept this is the way it's done here. But to actually find yourself in a low to middle income country where the resource challenges are immense, and yet still they have a quality to their healthcare that is admirable, it makes me think when I come back to the UK, perhaps I can do things differently. And I certainly have found that impacting on several areas of my professional life. One practical example of how it really has helped me as a professional is in an early project back in 2012 when I just went out there with a listening ear and I found myself talking to the TB team there. And that's a nurse-led team. But operationally, it really is delivered by one clinical officer and 36 volunteers. And I just sat down with them with the shared value of a nurse to nurse and said, you know, what are the problems? What are the constraints? And out of that conversation came the need for these volunteers to be better equipped by just getting them a bike each to go out into the communities. So I took that easy project back to the UK. We quickly raised monies for the bike. And so out of that conversation with a nurse, it encouraged the team enormously. They got a bike each. There were hundreds of patients were better supported through that. That was my contribution, if you like, to Zambia, but what was their contribution to me? And what came out of that was the treatment completion rates in Scotland were lower than what they are in Zambia, despite our much greater resourced TB service. And that got me thinking, I think we can do things better here in Scotland. And so that experience really helped me then to go back and discuss this with my TB nurse colleagues, with presenting at a national conference for multidisciplinary groups, just to look at how treatment completion could be brought up to higher than the World Health Organization standards. And that has been one way, I think, that has really helped me to make a difference back in Scotland, but the seeds were sown in Zambia.